and I had to take them off. I was like, YouTube, Facebook ain't in the house. Okay, but now Facebook in the house. Hello, hello, hello. It's good to see you. Hello, Facebook. Hello, YouTube. YouTube, thank you guys for being so patient with me. Facebook in the house. Yeah, yeah. So I'm so excited, guys. We are going to talk about something other than COVID. I know you guys are like, what? For real? Dr. Jen, talk about something different than COVID? Yes, I do. Yes, I do, hunties. Yes, I do. And honestly, I know just like you guys, I get a little tired of COVID too. So we are going to talk about something that literally came up tonight when I was in the office. It pretty much comes up, I would say, every day I'm in the office. This is a really, really, really important topic where I, as a family doctor, by the way, you guys know, I go live on Mondays and Fridays, okay? If you have not hit get notifications, please hit get notifications so you can join me every Monday and Friday for lives and then catch videos in between. Back to the story, y'alls. Every day I'm in the office, I have some conversation with my patients about them not wanting or them not taking medications I've prescribed or that I want to prescribe, them not wanting to take medications I want to prescribe. And this is something that's been on my heart for a long time, where I've been like, you know what, I really, really, really need to talk about this. But it took me a while to figure out like how to discuss it, you know what I mean? Like how I wanted to bring it up. Because there's a lot of reasons I've learned why my patients don't want to take medications or don't take the medications I prescribe. And one of the things I want to know from you guys is I'm really curious to hear from you guys, like if you guys have ever been prescribed a medication by your doctor, or it's been recommended that you take a medication. Like good examples are like, I think you need a cholesterol medication. We need to put you on a statin for cholesterol, or maybe your doctor wants to put you on a blood pressure medication, or maybe they want to put you, or maybe they're recommending a medication for depression or anxiety, or maybe they're recommending some other medication. Have you ever had an experience with your doctor where a type of medication was recommended for you for some medical condition, but you have either not wanted to take it, okay? Hold on. You have not wanted to take it, or you didn't take it when it was prescribed. So I want to know if this has happened to you, if you've been in this situation. And if so, maybe why you felt that way, either why you didn't want to take the medication, why you didn't take it or didn't want to take it, or a combination of both, because this is definitely something I want to hear from you guys, okay? So we are going to go through the 7 most common reasons why patients, they're most common to me, 7 most common reasons that I see that my patients or patients in general do not want to take the medications that their doctor prescribes. But I'm also going to give you ways to deal with this with your doctor if this is you or someone that you know, okay? Because I know that if you feel this way, or if you've been this way, or you feel like you're kind of in a battle with your doctor about something, a medication or something, you're not alone. And one of the reasons why I'm doing this segment is because I've lately felt like there's a couple of patients I have that, one patient in particular, I really, really feel needs to be on a cholesterol medication, like super, super duper. And this happens over and over again. It's not just this one patient, right? I have many patients over the years that I felt like this. I really, really, really think they need to be on a cholesterol medication, to statin, and they are just adamantly refusing, adamantly against it, okay? Or same thing with blood pressure. I have patients that I really, really, really believe should be on a blood pressure medication, and they are just not for it. Or when I prescribe the medication, they have not taken it. So let's talk about this, okay? Why? Okay, so the first thing, before I get into the seven reasons why, is I want to encourage every single one of you. If you ever find yourself in this situation, I want you to feel comfortable and to remember the importance of speaking up. Remember, you're the patient, and the doctor is your partner. You should be partners. We should be partners in the office. It's not this old paternalistic view where I'm the doctor, do this, do as I say, blah, blah, blah. Like, it's not supposed to be like that anymore. It used to be like that back in the day, this sort of idea that whatever the doctor says goes. But you know what? We've learned more. We've evolved. And we know that, it's really important. This doctor-patient relationship is a relationship. And trust is important, and feeling comfortable is important. Feeling like you can talk to your doctor is important. All these things are really, really important, right? So the first thing I want you to feel, if this is you or someone that you know, is make sure that you speak up. you have every right to speak up and say, hey, doc, I know you want me to take this cholesterol medication, but I'm really not up for it, or I'm really reluctant, or I'm really unsure, or I really don't know that I want to, or I really blah, blah, blah. You know why? You know why I want you to say that? Because number one, it's true and it's how you feel. And number two, us knowing how you truly feel will help us work out a plan that works best for you and your health. Because that, by the way, is the goal, right? Isn't that the goal here? Is you and you having not only a good experience, because, right, this is not just about like, this is not an amusement park ride, but you should have a positive experience with your doctor. And this should be a collaboration. Okay, so that's the first thing. Long-winded, I know, but I want you to feel comfortable speaking up because you know what? Like, you're the person, you're the patient. Like, this is your body, this is your life, and you should feel comfortable, or rather, I want you to feel comfortable doing that, and you have every right to do that. Okay. Now let's get into the most common reasons that I see why my patients do not want to take medications that I may prescribe. In no particular order. Okay. Number one, fear of side effects. Okay. I have a number of patients that I've seen over the years, even some today, that are concerned about side effects, whether it's anxiety or depression medications, cholesterol medications, blood pressure medications, asthma medications, you name it. Okay. People, rightfully so, are worried about side effects. What could this do? Will it make me gain weight? Will it cause my heart to race? Will it cause my mood to change? Will I feel like myself? Will I feel funny? Will I have erectile dysfunction? And by the way, I throw that out and I say that because all of these things are equally as important. And I don't want you to say erectile dysfunction. No, no, no. Some medications can have that side effect. Some people worry about that, just like everything else. So side effects, I would say, is one of the biggest things my patients are concerned about when they express to me that they don't want to take a medication, or they're reluctant to, or that they don't, is side effects. Okay. Now, remember, at the end, we're going to talk about ways to get around these concerns. But I want to let you know, if this is you, I don't want you to feel like you're alone. And yes, one of you just mentioned that 15 minutes is tough to talk about all this. You're exactly right. The person who wrote this, Gary. But this is why sometimes we need to have 2 office visits. Sometimes this is why we start a conversation and then we continue it the next week, because it's just that important. Fear of side effects is, I'd say, a huge reason my patients don't want to take medications. Number 2, no particular order, cost. Okay. We might prescribe a medication. And by the way, guys, we don't always know how much something is going to cost based on your insurance plan. Sometimes we have an idea. Many times we don't. There are some medications that I know my patients can get $4 at certain pharmacies, Walmart and Target and whatever. There are other medications that I have a pretty good idea probably will be expensive, just given what I know about them. It's just a guess. But to be honest with you, we don't always know what your insurance is going to cover and what it's not. So one thing I will tell you is that if you're ever prescribed a medication and it's way, way, way cost prohibitive, okay, you need to have a backup plan. You need to have a plan B, okay, and you need to figure out how to work this out with your doctor. Like, one thing I say to my patients, and again, this is just me, okay? I can't speak for what's right for you in your doctor situation, but in many situations, I'll tell a patient, if I'm starting them on a new medication, I'll say, if you get to the pharmacy and it's super expensive, don't fill it, but call me and let me know so I can change it. Now, again, that can't apply to every situation, every medication, and every patient, right? That's just an example of what I do with some scenarios and situations in patients. But the idea is, it's important for you to feel like you have the agency to communicate this, to your doctor, that, hey, this is too expensive. And I've had a lot of patients over the years that just don't take their medications, or they ration them, take a pill every other day, cut them in half, things like that, to make them last longer. If you are doing that and cost is a problem, please let us know so we can help. Sometimes we have samples, sometimes we have coupons. Many times we can change the medication altogether. We can try to help out. And some pharmaceutical companies have programs that patients can directly apply to get assistance. Okay. All righty. Let's see here. Number 3, again, in no particular order. I have a number of patients that don't want to, or reluctant about meds because maybe they don't fully understand why I want them to be on a medication. In other words, there's a misunderstanding about what the medication is for, and maybe the importance of the medication, like what it's supposed to do. You know what I mean? Like, take, for example, someone who has like heart disease, heart failure, coronary artery disease, I don't know, some combination of the two, maybe some peripheral vascular disease, I don't know, throw that all in there. It's not uncommon for patients to have some components of all three of those in different degrees. And a patient who has that may need to be on multiple medications that do different stuff. One or two medications, maybe they work specifically on the heart and the pumping to make sure the heart is pumping. Another one may be keeping the blood nice and thin so that, it's just smoothing and grooving through the blood vessels and not getting caught up in clots. Another one might be helping those arteries that are down in the toes and things like that. Now, my point being is, sometimes there's a misunderstanding. And let me be clear, maybe I should say, sometimes we as doctors don't explain well what medications are for. How about we say that? Huh? Yeah. Okay. Sometimes we don't tell you what we're giving you the medications for and why they're important. So if someone has a misunderstanding, they don't, if you don't know what it is that you're taking and why, you may not think it's important to take and therefore may not take it. Okay. So that is something that I implore us to doctors. And by the way, I would say us doctors need to really do all of these things. So this is not just on patients. Doctors, we need to be making sure that we are going through side effects with our patients. Doctors, we need to be making sure that we are telling our patients what the medications they are on are for, so they understand. And we need to also just sort of make sure that, it can't hurt for us to check in and say, hey, were you able to get the medication? Okay. Were there any problems at the pharmacy? Blah, blah, blah. Can't hurt for us to do that, docs. Okay. So just a little shout out to my peeps out there. Number 4, no particular order. I have patients that will tell me, or they feel that they don't feel bad. So why do they need a medication? Take high blood pressure, for example. That's a classic one. Cholesterol is pretty much similar too. You're not likely going to feel high blood pressure unless it's super severe and it's sort of what we call either end stage or it's an emergency, blah, blah, blah. You're not going to feel it. You're going to be like, oh, I feel my pressure. Now, some people feel like they get headaches and this and that when they have high blood pressure, but I would say most people, when their pressure is high, don't actually know it, okay? Or same with cholesterol. For the most part, people don't feel high cholesterol. You're not going to feel that. And so some of my patients have expressed to me over time, they even said things like, well, doc, I feel fine. As though the medication would only be indicated or only would be important if you didn't feel fine. Well, this is where docs also have to do a better job because this goes back to us explaining why medications are important. But just understand, and we need to do that better, but please understand that feeling fine doesn't necessarily negate the need to take medications, okay? Because it may be doing something in your body and helping out all your organs and things like that without you even knowing it, helping you on the inside. So please just understand that that's the case, okay? All righty. Another reason, number 5, no particular order, you may not trust your doctor. Why do some people not want to take the medications their doctors have prescribed? They don't take the medications their doctors have prescribed. They don't trust the doctor, right? And that's a problem. It's a problem for us doctors. And it's unfortunate for patients. That's not the situation I want. I don't want you as a patient to feel like you're being taken care of by a healthcare facility or a doctor, et cetera, a healthcare provider that doesn't actually have your best interest at heart or doesn't listen to you or that you simply don't trust. It's really hard to follow instructions and to believe and to listen to someone or something that you just don't trust. I don't know that I would do it. So I wouldn't blame anyone who said that I'm not sure I trust this. And that goes back to we as doctors making sure that we're explaining things properly, that we're answering questions, that we're going over side effects, that we're also clearly explaining what medications are for and what the importance of their use is, okay? But once again, I also want to implore you to understand that these things are your right. These things for you to know, like understanding side effects, understanding things that even if you don't feel bad, the medication could be important. Understanding what the medication is for. These are things that you have every right to know, okay? Because again, it's one of the top reasons I see, these are some of the top reasons I see why people don't want to take their meds. All right. Next is people worry about becoming dependent. I hear this all the time. That they say, I had a patient say to me today, will I have to be on this forever? Will I have to take this for the rest of my life? Or will I become dependent on this medication? Will I ever be able to get off of this medication? And I understand the need to want to have a better understanding about that. It's important. You want to kind of understand what things kind of look like, what things are looking like for you. And I know that dependency is a big problem or a big concern for a lot of people. I would say, on the other hand, however, there are very few medications. I'll put it this way: the vast majority of medications that we as family doctors prescribe are not habit forming or will make you dependent, meaning will make you have side effects if you don't take it. Yes, there are some, but we should be talking about those things with you. Most medications will not make you, say, dependent. Now, on the line of, are you going to have to take this medication forever? That's something that you will have to talk with your doctor. Remember, we are not genies. We are not all knowing, so sometimes we can give you sort of a probability and give you an idea of what the likelihood, and maybe if this or that, or you're able to lose weight and this and that, you can get off your diabetes meds, blah blah blah. But sometimes we may not know. But understanding that this is one of the things I think that keeps a lot of my patients from wanting to take medications, is they're concerned they will become either dependent, which by the way is only a small percentage of medications, or they will have to take it forever, which some medications, yes. But this brings me to my last point, which is by far, this last one by far is the reason why and actually, you know what, I'm going to throw in another one. This is one that you guys are saying that let me throw this in. I'm going to throw in actually a number 8, even though actually, why don't I throw this in now? You guys are asking about natural alternatives and natural remedies. Okay. So I do agree that a lot of times my patients don't want a medication and they want something so-called natural, whether that's a supplement, whether that's a vitamin, whether that's a behavioral change, like certain types of exercises, or other types of behavioral changes. A lot of patients may not, maybe you too, a lot of people may not want medications. So let me tell you why I feel a lot of doctors don't recommend some of these so-called natural things. And I know it's frustrating. It's not that, and okay, any doctors out there, feel free to weigh in. Let me know if you agree with this or not, but this is my take. This is my opinion. And I'll tell you about myself. It's not that I don't want my patients to do natural things. If I can not have you take a medication, that's a win-win, win-win-win for all of us. Are you kidding? That is golden. The thing about it is that, number one, sometimes and oftentimes we are prescribing what we call natural things. Like, think about diabetes, hypertension, high cholesterol. The first treatment, probably one of the most effective ways to not be on medication, is to keep a healthy weight, eat a healthy diet, make sure you're exercising and things like that. Guys, that's natural. Okay. Now, when it comes to supplements and vitamins and things like that to help things like cholesterol, blood pressure, heart disease, and things like that, I'll be honest with you. One of the reasons why sometimes I can prescribe supplements and vitamins for things like fish oil is great for triglycerides and things like that. But sometimes, and oftentimes, I cannot. Remember, vitamins and supplements are not necessarily regulated by the Food and Drug Administration. What that means is that there's not always a lot of studies and data to suggest and to show and to prove that these things work on maybe the stuff I'm trying to treat. So it's not that I don't want my patients or don't want you to take something natural. It's just I can't promise you or tell you in good faith that it will work. That's why. It's not that we're against it. It's not against natural things. It's just that we don't actually have a lot of knowledge, because a lot of these supplements and vitamins and things are not tested. And the other thing is because, Food and Drug Administration doesn't always regulate supplements and stuff like that. We sometimes the bottles and what's in them is not actually regulated either. We don't actually know what's in each pill, that it's the same amount for each pill, et cetera, et cetera. Okay. And again, not saying natural doesn't work, but this is why your doctor may not recommend what you consider natural for everything. What we do often have data about, and hard scientific data, is the medications that we're prescribing. And we can tell you about the risks and the benefits. And we also can tell you about the importance of eating a healthy diet and exercise, et cetera, because that's been studied rigorously as well. Okay. So also remember that sometimes natural things that are considered natural, supplements, vitamins, and things like that, actually can do harm. Anything can do harm if it's the wrong thing, if it's taken in the wrong amounts, and for the wrong person. Okay. So I've seen people taking certain supplements go into renal failure. Okay. I'm just saying, what I'm saying is that there are potentially side effects for any and everything. And what your doctor is going to do is very likely they're going to use what we call evidence-based medicine. And they're going to recommend the things that have been studied most rigorously the most, and recommend the thing that has the best evidence to help you with that condition. So it's not being against natural, but that's just why, okay? Now, the next thing and the last thing is I think a lot of my patients don't want to take medications because, and I literally said this to someone today, I get this sense, and I also want to know what you think. I get the sense that sometimes my patients feel as though they're somehow less if they're on medications. Like somehow it's a badge of honor if they're not on medications. It's like the ability to say, oh, I'm not taking any meds. I get the sense that some of my patients feel like there's a sense of pride in being able to say that. And by the way, I get it. But that the alternative or the idea of being on medication somehow is almost like getting a bad grade on a report card or implying that you're somehow less. And I actually asked some of my patients about this, who have seemed to me as though they take a lot of pride in not being on medications. And so they don't want to take medications being recommended because they feel like somehow that makes them less than, that they prefer to not be on them because they think that that's a better way to be. That seems like a better way to be. And you know what I say about that is I think it's important for us all to examine why we think the way we do, okay? I say to my patients, if a medication is going to allow you to live till 115, as opposed to having a heart attack in 5 or 7 years, 115 is a joke, guys. I'm just saying this. If a medication is going to drastically reduce your risk of having a heart attack versus not, it just seems like taking that medication is by and large the smarter, healthier thing to do. And I also want to remind us that your need for a medication doesn't mean there's anything wrong with you. See, remember, everybody's different. Some people are born with genetic conditions, genetic predispositions, conditions that you absolutely have no control over, that you didn't do anything to cause, but they are there. You know, medication is not a sign of a weakness. It's not a sign that you're flawed or that you're somehow not as good as. And if for some reason you feel like society is making you feel this way, then that is wrong. Because the truth of the matter is, if taking 3 or 4 or 5 medications is what's going to allow you to live a long, healthy life, then that by far is the best thing than not. And remember, not taking medications that your doctor has prescribed you because you don't like the idea of being on meds doesn't actually take away the condition that they're trying to treat. Doesn't make it go away. If you choose not to take blood pressure medication and you need it, not taking the medication doesn't make the blood pressure go away. And you're still at risk. You're just not doing anything to help and to improve your chances of, say, not having a stroke or not having a heart attack or things like that. So what I challenge us all to do is to think about why it is that we are opposed to medication, if you feel this way. And the first thing, as I mentioned before, is to tell your doctor, hey, look, I don't know about this. I don't know if I want to take it. I don't know. I'm not sure. Tell us so that we can help understand why you feel that way. Is it one of the 8 things I mentioned? Fear of side effects or cost, not understanding the need for medications. You don't feel bad, so you don't know why you need it. You don't trust me or your doctor. You worry about dependency. You want something natural, or you just feel like you don't want to be on a medication because it just doesn't feel good or sound good. The idea is think about really what it is that you're feeling, because what it comes down to is risk versus benefits and being honest with yourself and your doctor. Now, the bottom line is you don't have to do anything you don't want to. You don't. I have patients that I have literally said, I am concerned that if you don't take X, Y, and Z, you will have a heart attack very soon. And I have had them look back at me and say, that's okay. I'm still not interested in taking the medication. Okay. And you know what? I respect that. But what I always say is before you or someone else decides to take a medication or not, or rather, I say even to take it or not, especially not to take a medication, it's going to be really important to understand what could happen if you don't take it. So at least you're informed. You know, and this goes down to understanding why your doctor wants you to take it. You don't want to take the blood pressure medication or the asthma medication or this and that. Say, doc, if I don't take this, what could happen? And that way, at least you're informed, you know. And you can make an educated decision for yourself, okay? what I would also say is many of you guys are asking about, wouldn't it be better to activate your body to heal itself? Wouldn't it be better to do natural things, etc.? So wouldn't it be better to, and the answer is, well, if that can happen, certainly. But that's sort of assuming that everyone can control their health in the way that sometimes others can. We have to understand, remember, there are many medical conditions that happen to people that didn't ask. They did nothing to make it come on. And they can't do anything to make it go away. Okay? Remember, that happens. Not every condition is preventable. Not every condition is necessarily treatable without medication. I wish it were. But to say, oh, you're going to be perfectly fine if you just treat yourself or do only natural things or whatever, well, that's misguided. That's as silly as me saying that you're only going to be treated only if you take this medication. That's misguided too. We have to look at every situation as they come, every patient as they come, and decisions have to be made individually for each person. But what I ask is that you not block certain things out because it doesn't fit within the box of what you're hoping for, because sometimes we need a number of different things. So, guys, I hope this is helpful. I hope this wasn't too much of a soapbox, but I really did want to talk about this because it was something that's happened tonight when I was in the office. It happens all the time when I'm in the office. And so that's how I would approach medications with your doctor. Make sure that you're understanding those 7 or 8 things that we talked about that oftentimes are misunderstood. Make sure that your doctor is giving you explanation. That is on us. And if we are not giving you side effects and things like that, then we should be doing that, okay? And remember, you always have the right to decide what you want to do. I just ask you and advise you to know the pros and cons of not taking a medication before you decide that. Before you decide you're not going to do X, Y, or Z, or you will do X, Y, and Z, know the pros and cons, okay? So I hope this was helpful. I know this has been a long session, but I had to get that off my chest. Thank you guys for the stars on Facebook. I see you guys. I'm kind of reading your comments here and there, and you guys have given me actually a lot of suggestions as we have gone through this session. So thank you so much for that. I hope this was helpful. I hope you spread the news and spread the word too. And remember, 4 to 5 medications keeps you alive and helps you live an extra 30 years. I'd say take the meds. But what I'm not saying is that it's all about meds. I'm just saying it's all about risk versus benefit. And that's what you need to talk with your doctor about. The stars are so appreciated. YouTubers, it's good to see you guys. See, we didn't talk about COVID tonight. I hope you guys are doing well. Ethan, you got fully vaccinated today. Congratulations, Ethan. And by the way, since we were talking about this, guys, put a thumbs up or your favorite emoji in the comments. You know, this is like my favorite part of the lives. Put your favorite comment in your favorite emoji in the comments if you got your COVID vaccine, because I know so many of you guys have. And let's see here. What else are we going to talk about? To see. Superstars, by the way, if you guys are interested in joining my subscription groups, Dr. Jen Superstars is my private subscription group on Facebook, and then I've got subscription groups on YouTube. Those who are members of my group get discounts for merchandise such as t-shirts and things like that. The Dr. Jen Superstars gets a private live every Wednesday. It's awesome because I'm usually in the kitchen making dinner, drinking wine, some combination of the both, and so we have a great time chatting. So I see all my superstars on here. It's good to see you guys. Also, for those of you getting your COVID vaccine, make sure that you've joined my group, I Got the COVID Vaccine, on Facebook, so that you can share in your vaccination story. Tell us you got the COVID vaccine. If your kids are getting the COVID vaccine, it's so neat seeing all the 12 to 15-year-olds in the group getting their picture and they're holding up their arm like this, which is awesome. It's just so inspiring to see. So I love it. And I see all your emojis you're putting in. You guys have gotten your COVID vaccines. I love it, guys. You are amazing. And then, of course, Healthy Living with Dr. Jen. If you guys have not liked and followed my page, if this is your first time here, I feel like I sound like like the pastor at my church. It's okay. He's like, you guys know what this is like at church, right? They're like, the pastor's always like, if this is your first time with us, we welcome you. And if you're looking for a new church home, we welcome you to join us. That's how I feel like. If you're looking for a new Facebook page home, I welcome you to my space, and we welcome you with open arms. And so it's so good to see you. Make sure you like and follow my page, guys. I do daily videos on all sorts of stuff. I love y'all as always. I'll be back tomorrow with more stuff. Thank you guys for the stars. YouTube, thank you for the super chats and the super stickers. Mwah. Guys, I'll see you soon. All right, YouTube, love y'alls.